Dear friends, I am Dr. Manish Gaur Gupta. I am consultant laparoscopic and robotic surgeon at Sir Gangaram Hospital. I have my own clinic with the name New Life Clinic at Indrapuram, Ghaziabad. Friends, I will be talking about a very common problem today, which is hernia. So we all sometime or the other heard about hernia, that someone has got hernia and got operated. So what is hernia? Hernia is basically whenever the content of the abdomen comes out through an opening, which is an abdominal opening or a normal opening, and present as a swelling or a lump over the tummy. So whenever such sort of a swelling appears in the abdomen, patients get worried what this type of swelling appeared in the over the abdomen. So these hernias usually present with whenever patients walks, coughs, sneezes or strains. These swellings come out through these defects, and whenever patients lie down, these swellings go down into the tummy. So these are the initial symptoms, and as the time passes, this defect gets increases in size, and more and more internal component like intestine or fat comes out through this opening, and the hernial swelling sizes keeps on increasing day by day. So what happens in hernia, that it can occur in any part of the abdomen. The most common site for developing these hernia are basically belly buttons and in the groin region. And if a patient has undergone some surgery, some operation for some intestine or something like that in the abdomen, this is the weaker side, and from this side a hernia can appear. So initially the symptoms is like there is a lump which comes out and goes in once you presses or you lies down. But as the time passes, the chances of complications can occur, and the complications are initially irreducibility. It means that it doesn't go inside the abdomen and remains there because there are some adhesions in between the content of the hernia and the abdominal wall. And the second complication is that obstruction. It means that intestine has come into the hernial sac, and there is non-passage of any content like food or any fluid through the intestine, and patient gets started vomiting. There is distension of abdomen and pain. The third complication is that whenever the blood supply of this intestine gets disrupted, then there is strangulation. It means that it can lead to gangrene of the intestine. So these complications are like an emergency complication, and one has to go and get operated as early as possible so that one doesn't develop any gangrene of the intestine. The treatment for hernia is basically surgery. Whenever one sees such hernial swelling, one should go and contact a surgeon so that he can advise you when to go for surgery, but the earlier the better. One should not wait and watch to get the complications to occur. Nowadays, the surgery for hernia is basically a laparoscopic surgery. It means that we make 3 small holes, which is like pencil size holes, through which we put a mesh, which is a polypropylene or a biodegradable mesh, and put this mesh over the hernial defect and fix it with multiple tackers. Nowadays, the chances for recurrence is quite less because of formation of application of these mesh over the hernial defect, and there are few precautions one can take. There are some precautions which a person can take, like one should not sneeze too much or cough too much, so that these hernial swellings don't increase in size and don't get impacted into the defect. So friends, I have told you about hernial swellings today, and if you have such problems, then you should go and meet a surgeon, or if you want to come to me, you can come at Gangaram Hospital, which is in Central Delhi, or you can come to me and meet me at my clinic, which is in Indrapuram, Ghaziabad, or you can talk to me through Librate. You can chat me or you can text me through librate.com. Thank you very much.